So, when doing a head to toe assessment on a client, I would first check the physician orders. I would check the client's care plan and see any allergies that might be noted in the client's chart. I would then gather my supplies and perform hand hygiene. For this, I would just need the stethoscope and a pen light and an alcohol wipe for this assessment. I would then knock on the door. Hi, my name is Sarah. Can I come in?
Yeah.
Hi. My name is Sarah, and I'm going to be your student nurse today. Can I see your wristband?
Yeah.
And can you state your name and date of birth, please?
Jesse Edelman, 3894.
Perfect. So what brings you in today?
I have a headache.
Oh, you have a headache. Okay.
Mm-hmm.
Well, I'm going to go ahead and close the curtain here and provide privacy for you. So we will be doing a head-to-toe assessment. How long have you had this headache?
About 3 or 4 days.
About 3 or 4 days? Okay.
Mm-hmm.
What kind of pain are you experiencing?
It's like a throbbing pain.
A throbbing pain?
Mm-hmm.
Okay. All right. I'm going to go ahead and gel in. So I'm going to take your blood pressure and get your vital signs, okay?
Okay.
So this is the part where we would get the vitals. All right. So after the vitals are performed, then on a scale of 0 to 10, 0 being no pain and 10 being the worst possible pain, where are you at on
about
that scale?
6.
About a 6? Okay. All right. So I'm going to go ahead and check your head.
Okay.
All right. I'm just kind of feeling for any bumps, lumps, feeling for any swelling in the area. Okay. And next, I'm going to check your eyes.
Okay.
Right. So here's my pen light.
Mm-hmm.
Can you look straight ahead and just follow your eyes with the pen light, okay? Now I'm going to come a little closer to you, so just focus on the tip right here, okay? Okay. All right, so we're going to check this eye first. Just try to look straight ahead. I'm going to put my light on the side of the eye, okay?
Okay.
Look straight ahead, please. Okay. I'm going to check the other side. Okay, so you have good constriction and dilation. Your eyes are, they're able to retract light well. You have good movement. I was able to measure your eyes, and you're at about a 5 millimeter diameter. So your eyes have good perla. And next, I'm going to check your movement. So can you grip onto my hands? Perfect. Give it a good grip. There you go. Okay, now let go, and I'm going to put your hands up for me and try to push on them best you can. Give it a good push. Perfect. Okay, now I'm going to check the feet. So go ahead and raise this up and try to push, okay, when I push down. Very good. Give it a good push, best you can. And then we're going to flex. Good. Okay, let's flex for this foot as well. We're checking for the plantar and dorsal flexion of the feet.
Okay.
Very good. Okay. All right. Next, we're going to check your face. So can you raise your eyebrows for me? Can you squint your eyes? Can you blow, like kind of puff your mouth like this? Perfect. I'm going to check the inside of your mouth really quick. Can you just kind of go, ah? Okay, so the lips look healthy and pink. The tongue is shiny and pink. I don't see any sores. The mucosal lining looks healthy. I don't see any sores or any open areas in the mouth. Okay, perfect. Now I'm going to check your respiratory and your lungs and
Okay.
just kind of hear for some sounds, okay?
Okay.
Okay, I'm just going to sit right by you here. All right. Go ahead and take a deep breath in and out. Okay. In again. And out. In. And out. In. And out. Perfect. Okay, I'm going to come behind you here and I'm going to get your, the back side of your, we want to hear the back side of the lungs, okay?
Okay.
So go ahead and take a deep breath in and out. In and out. In and out. Perfect. In and out. In and out. In and out. Okay. So everything sounds normal. I'm also going to just palpate and feel for any swelling, any masses. Have you had any pain in your back or have you had any tenderness or anything?
Nope.
No? All right. I'm going to check the front here. Okay. It feels good. No bumps, lumps, no no swelling that I can feel in the area. All right, so the next thing is I'm going to check your heart, okay? So let me put this back on. All right. So So the heart is nice and regular, and you have a nice strong heartbeat. I'm going to check for 30 seconds, and then I'm going to get your radial pulses as well, okay? So let me... There we go. Okay. I'm going to check this one more time. I'm going to go a little lower. All right, 65 beats. Okay. And then I'm going to just check, could you bring your arms up, please? And I'm just going to check both of your radial pulses, okay? And I'm going to feel for 30 seconds. Okay. Start at the 6, okay? I got about 66. So your radial and apical pulse sound nice and strong. Okay. So next, I'm just going to inspect here that you have an IV on your left arm. And so I'm just going to check and make sure that it's the right solution for the IV bag. Okay. And are you having any pain, any tenderness? I see that your skin is healthy and feels like a normal temperature. Is it causing you any pain or anything? Okay. All right. Okay. So next, I'm going to bring this down. I'm going to check your pedal pulse, okay? So you want to just rest your foot on my knee here. All right. I'm going to count that for 30 seconds. Okay, I got a 65. Very good. Okay, so next, I'm going to check your gastrointestinal region. So could you just pick up your shirt for me? Mm-hmm. All right. So before I even, let me pick this up. Before I check this area, I'm just going to check for and see, make sure that there's no bruises, open skin. Check the client's color and just kind of feel the area for any swelling masses. And then I'm going to go ahead and feel your abdominal area, okay? Or listen, auscultate the area. All right. Okay, very good. Everything sounds normal. And then I'm going to go ahead and feel the area. Just let me know if you have any pain, okay? I'm just going to assess the area and kind of feel around in the abdominal area and kind of feel for anything abnormal, okay? Let's pick this up one more time. I apologize. Okay. Does that hurt? No? Okay. Everything feels normal. There's no swelling. Okay. Alrighty. And I've noticed the nipple area. I'm checking for any secretions, any open skin in the area. Everything looks normal on the client. Thank you. Go ahead and put that back down. And next, I'm going to ask really quick, how is your, do you know the last time that you had a bowel movement?
Earlier today.
Earlier today? Okay. What was the size of the bowel movement? Would you say like a small, large, medium?
Medium.
About a medium? Okay. And what was the color of that bowel movement?
Blackish brown.
Blackish brown? Okay, so it was pretty normal color. Let me see. And then for the urinary, how have you been urinating? Is there any cloudiness in the urine? Have you had like dark yellow urine or lighter color?
Lighter yellow urine.
Kind of lighter yellow?
Mhm.
Okay. Let's see. How often are you drinking water every day? Like, do you drink?
Probably about at least a gallon of water a day.
Oh, good. Okay. So you're getting plenty of fluids. Let me see. And then at this time, if the client were to have like a catheter, I would check and observe the urine, check for the odor, color, how frequently the client's urinating. And let me see. I think the last thing that I'm going to do is check your musculoskeletal system, okay?
Okay.
So I'm just going to check your joints and just kind of feel the joint areas, all right? Okay, so I see the transverse part of the chest is in good symmetry. I don't feel any swelling or masses on the elbow region. Could you, here, I'll pick up the shirt really quick. I'm going to check your back and check pressure points. I noticed that the back feels normal. There's no open areas or sores. The knees look good. There's no sores on the knees. I'm also going to inspect your heels really quick, and it looks like these pressure points are good. Okay, and then I am going to do some range of motion on your knees, okay? So let's bring this down a little. Okay, so you want to go ahead and flex, and then let's extend. And then we're going to come outward and then adduct. Very good. Okay, now let's check your elbow on this side. So we're gonna flex, extend, and then we're gonna, can you bring this and then kind of put the palms outward? Very good. Okay, and then we're gonna check the other side really quick too. Okay, so we're gonna extend the knee, bring it back, flex it. All right. And then let's see, we're gonna go outward and inward, adduct. Okay, very good. And then let's do some range of motions on this arm. Are you having pain here?
Mm-mm.
You're not having any pain. Okay, so let's go ahead and flex, extend, and then with both arms again, supinate for me, and then pronate. Perfect. Okay, very good. All right, so how is your do you get enough exercise per week?
Yeah.
Yeah, how many times a week would you say that you exercise?
3 to 5.
3 to 5? Okay. And do you have a good support system at home? Like, do you have access to any family support?
Yep.
Okay, good. All right. So then the assessment is complete then.
Okay.
At this time, I would document the client's mood, document anything that I had observed during the assessment, any findings that I may have had. And then last part, I would clean my stethoscope and wipe it down. And then I would document, lower the bed for the client, make sure that the bed is in a low position, ask if they need anything, and perform hand hygiene before leaving the room. And that will do it for the head to toe assessment.